In this video, we're going to talk about a common health emergency for someone who's acquired a spinal cord injury called autonomic dysreflexia, also known as AD. The learning objectives are listed above. We'll discuss what autonomic dysreflexia is, the common signs and symptoms you might experience, as well as typical causes, and then the action steps that you can take if you feel like you are experiencing autonomic dysreflexia. To start out, autonomic dysreflexia is a syndrome in which there is a sudden onset of excessively high blood pressure. It can lead to serious stroke, seizure, organ damage, permanent brain injury, or even death if not treated immediately. It is more common in people with an injury at T6 and above, and rarely happens if your injury is below that level. Autonomic dysreflexia happens because there is a change in the body's autonomic reflexes after your injury. The autonomic nervous system controls body functions such as blood pressure, heart rate, body temperature, digestion, sweating, sexual function, and dilation of your eye's pupils through signals sent back and forth from the brain and the body through the spinal nerves. These functions are mostly involuntary, meaning that it's controlled without you even thinking about it. However, after you've had your injury, then damage to these pathways occur and signals get lost along the way. Autonomic dysreflexia can be life-threatening because blood pressure can rise to dangerous levels when your body is in a fight or flight mode. The blood pressure is always given as two numbers: your systolic, the top number, and diastolic, the bottom number. Typically, we see this range around 120 over 80. Blood pressure changes depending on what a person is doing. So if you're exercising or in pain, you might be having higher blood pressure. If you're resting or sleeping, you might be experiencing lower blood pressure. Autonomic dysreflexia can be triggered by any kind of pain or discomfort that's taking place below your level of injury, even if you can't feel it. Some signs of autonomic dysreflexia include a sudden and severe rise in blood pressure, pounding headache, flushed face or red blotches on the skin, or sweating above the level of injury, stuffy nose, blurred vision, nausea, a change in heart rate, goosebumps or cold and clammy skin below the level of injury, and an overall anxious feeling. Some causes of autonomic dysreflexia can be any irritation to the body that's happening below the level of injury. So this could be a full bladder, which is the most common, a full bowel or even constipation, bladder infection or bladder stones, genital stimulation, pain, tight clothing or shoes, if you're getting any special tests done on the bladder, labor and delivery, broken bones, ingrown toenails, pressure sores or skin infections, and abdominal problems like gallstones, appendicitis, kidney stones, or ulcers. If you feel you're experiencing signs and symptoms of autonomic dysreflexia, then here are some things you can do. Sit up straight or raise your head so you're looking straight ahead. If you can lower your legs, do so. You need to be sitting in an upright position until your blood pressure is back to normal. Loosen or take off any tight clothing or accessories. This can include braces, catheter tapes, socks, stockings, shoes, and bandages. Empty your bladder by draining your Foley or using your catheter, and do digital stimulation to have a bowel movement. Then check your skin to see if any pressure sores are forming or if there's any red spots. Once you do those things, you should check your blood pressure every 5 minutes to see if it's improving. Go ahead and call your doctor even if your symptoms do stop and your blood pressure decreases. However, if the symptoms do return, repeat the above steps and go to the emergency room or call emergency services. If the signs don't go away, you can take the medications prescribed by your doctor for dysreflexia. Certain medications lower blood pressure that act quickly and last a short period of time. Also call your doctor and go to the emergency department. Tell the doctor or emergency department what signs you've been having, what you've done to help, and how your signs have changed. You can lessen the chances of AD happening by keeping up with your regular bladder and bowel programs, taking care of your skin, avoiding extreme heat or cold, taking your prescribed medications, and also by knowing your normal blood pressure. A piece of advice we have is to keep an autonomic dysreflexia wallet card on you to help react quickly if you're ever in the situation. Here's an example of what one of the wallet cards can look like. It tells you what autonomic dysreflexia is, your typical ranges for blood pressure, and what to do if you're in the situation that you feel like you might be having signs and symptoms. Overall, autonomic dysreflexia is a medical emergency, so be sure to have your plan in place of what you need to do and what you should look out for. Please reach out to your healthcare team if you have any questions along the way.